Hi, I'm Dr. Caitlin Keller with Unconstipated Kids, and we are going to help you and your child improve their bowel and bladder health. So oftentimes part of the home exercise program that I talk about with families is to practice bulging and relaxing the pelvic floor muscles during some belly breathing, and then also some purposeful practice similar to what we can do in the office during our therapy sessions. So I want to explain a little bit about what that position looks like, how your child is going to be positioned, how you will be positioned, and then the things that you'd like to work through to help practice this in between sessions so that you're not coming to therapy just once every so often. You're coming to therapy once every so often for some guidance, but then also you're carrying this out at home. So your child is going to be laying on their back on the floor, a flat, firm surface, so not a bed. Really, the floor is best, firm surface if it needs to be. But they're going to be laying on their back with one leg propped up against you so that they can stay fully relaxed, but also so that you can have access to feel their pelvic floor muscles as they work through these exercises. So once you get them into a good position, you next want to have them breathe through some just regular belly breathing and relaxation techniques that guide them however they work best in order to fully relax so that the muscles of their pelvic floor and around their external pelvis can also be in a relaxed state before you start doing these purposeful exercises. Once your child is in a relaxed state, you want to find the position that you're going to be palpating. So that means you're going to actually be touching through their clothing so that you can help tell them if they are successfully descending their pelvic floor and pushing down, or if they want to keep working at it. Ideally, we've gone over this in therapy prior to you seeing this video and practicing at home. But if you haven't, use this video as a starting place. Figure out what works for you and your child in terms of your comfort level and where you want to be, and then move through the specific techniques that I'm going to give you to help them practice bearing down and relaxing their pelvic floor. And the benefit of this is that you get to assess so you know exactly what your child is doing. So once you have them laying in a great position on the floor and they are completely relaxed, then you want to find the position that you're going to be feeling, palpating through their clothing so that you can feel how they're doing. So this is the pelvis. We are going to be looking at the pelvic floor muscles. So this is looking up at their bottom. So this is the anus and this is the urethra of a female. So once they're laying down, you're going to have the bottom of their pelvis be facing the hand that you want to be using. So if I'm right-handed, so if I'm going to use my right hand needs to be easily accessible to their bottom, which means that I'm going to be laying on the child's right side. I'm going to be sitting on the child's right side. Once they're laying down, their leg is propped up against you. What you want to do is you're going to go down the back of their thigh. You're going to feel their femur, the long bone of the thigh. You're going to feel down the thigh, and you're going to feel down until you feel this really big hard bump, which is the sit bone. This is the ischial tuberosity. It's the big part of the pelvis that sticks out. So you want to find that first. Once you find that, oftentimes if kids are nervous or if it's the first time, they might be clenching their butt cheeks at this point just because you are getting close to their private areas. Let me preface this by saying you've already done the work in terms of verbiage about why this is appropriate. They've given you consent. You've told them that you have consent for this. You've talked about that this is an exercise for a muscle. This is going to help their body become a better pooper or a better toileter. So you've already prefaced all of this. So as you're working through this, if they are clenching, you can work through some relaxation techniques and breathing as your hand stays here. I would not move it away if they're clenching unless they're really aversive to it. Use your judgment call for your own child. So once you're here, you work them through some relaxation techniques. I would not move over until they are relaxed and stop clenching. So once you find that big bone and they're in a good relaxed state, you're gonna go straight over. So if you can see my fingers here, it's going to go straight over. And when I go straight over, I'm not necessarily on the anus. I'm not going to be on the anus, and that's okay. So right now my finger is on the perineum. It's the area between the anus and the genitals. This is where the vulva is, or this is where the penis is. Your finger is going to be on the perineum, and that is still a great place to assess if they're getting descent as they work through some breathing and bulge techniques. So once your finger stays here, once your finger gets here, it's going to stay here for the entire time. So you're only going to touch right here. I want you to think about what you're doing with your other fingers, because that's important. You don't want to accidentally touch some other genitals or surprise your child with where your fingers are. So be really cautious about where your other fingers are staying, where your hand is placed. Typically, I like to say the rest of this hand should be in full contact with the butt cheek, just so that your child knows where you are in space. Once you're there, they're relaxed, then you can start working through the breathing and the push techniques that they know. I want you to remember also my finger position. Once it's there, I'm using the pad of my finger, so not the tip. So that means that I'm using my finger pad stays flat. It's not pointed in like this. This feels really invasive, and the pressure can be more. This is going to give you a better opportunity to feel what's actually happening, and it also feels safer for your child. So once you're there, you stay there, and then you start. So now that your child is relaxed and your finger is on the perineum so that you can feel what's going on as you work your child through these different techniques, there are really two basic things that you want to be doing. And you can go back to my belly breathing and belly pushing video for another review about how we can do this. I'm going to briefly go over it here. But you want to do belly breathing and belly pushing and feel with your finger what's happening at their perineum as they do this. And so what I mean by that is you're going to work them through belly breathing. They're laying on their back, they're nice and relaxed, they're taking a big belly breath. As they do that, you should feel a gentle descent of their pelvic floor muscles, which means the finger at your child's perineum should slowly and minimally, I'm going to say about 1/2 centimeter in terms of magnitude, it should descend down, meaning towards your child's feet. So not towards the floor, they're laying on their back, so not towards their floor, but towards their feet. And so when they're laying here, your finger is assessing, and they're taking some big belly breaths. And as they do that, their pelvic floor should descend with the breath, just because the volume in their abdomen and lungs increases with diaphragmatic breathing, which is the belly breathing that we want them to improve on, to use their diaphragm. So that's a diaphragmatic breathing. So belly breathing, they're laying on their back, they're in a good position, you're assessing at the perineum. Your fingers right here, you work them through, let's say 5 to 10 belly breaths when you feel some really good descent. Doesn't need to be more than that. Once you get to that number, once they have a good 3 or 4 in a row where they're actually descending, then you can move on to belly pushing. So again, go back to the belly pushing video for more details on this, but you're going to have them do a belly push, bulge their belly out, increase their intra-abdominal pressure, and then you're going to say things like, use the air that's in your belly and push down. Push your anus down towards your feet. Push my finger out and away. Push my finger down towards your feet, all while sustaining that belly push. So belly push, push anus down and out towards your feet. Count with your voice to 3. 1, 2, 3, and relax. So then you're going to work through that just as you did with belly breathing while you're feeling here. The entire time your finger is not moving. Your finger never moves from this position. If it needs to because of your own body position or mechanics, tell your child before you do that so that they're not surprised. So they are going to be laying on their back. They're working through belly breaths. You're working ideally so that you can get 3 or 4 good ones in a row. Sometimes that takes up to 5 or 10 reps to try. And if your child isn't getting any movement with their pelvic floor during this, that's okay. You're working on connecting their brain to the rest of their body through the neurological motor plans that need to be improved upon to get more coordination through their pelvic floor. So what that means is even if they're not having movement that you can feel, they're still getting benefit from practicing. So don't stop, don't be discouraged because you don't feel anything. So again, your finger stays here, you're feeling, you're palpating through their clothing, you've already worked through belly breathing. They do a belly push, and you're using those same words that I said before. So guide the air in your belly down and out. You can use your other hand, and I've used this in a couple of other videos. You can show them visually if this is your anus. You want to push it down and open. So using lots of different cues can be helpful because different children will respond better to different words. So you're pushing down and open, you're pushing your anus down towards your feet, you're pushing my finger down and out, you're pushing the air in your belly down, and then you're going to keep it there and then count with your voice out loud, 1, 2, 3. So then you're going to finish that, and then that's it. So really just 5 to 10 reps of each one, belly breathing and belly pushing, and then that's it. I like to recommend a higher frequency instead of a higher quantity. So that means practicing this every day is more important than practicing this for 10 minutes. Don't practice this for 10 minutes. That's a long time, especially if your child is having a lot of difficulty with this. That can be a little disheartening. So just practice, get their brain and their body connecting, get them thinking about the movement pattern. Practicing it most days of the week is most important compared to number of reps or the number of minutes that you practice this for. Thanks so much for watching. Don't forget to subscribe to our channel so you can find us later and help other people find us too.